Thank you for joining Chainwork TV. It's Dr. Marvin Sublet here in Miami, Florida, and we're proud to introduce Yasmine Egozi. We're here at Canacentric in Miami Beach. She's going to talk about a hot topic in health and wellness, CBD. It's a controversial topic. It's something that people know about but don't know about at the same time. So we're here to get to the facts and get to the bottom of some of the misconceptions and the benefits of CBD. So Yasmine, tell me right now about how you got into this industry in the first place and what drew you to the realm of CBD.
Absolutely. So first of all, thank you for having me. It's a real pleasure to work with you and to be here. And I'm excited to help further the education and knowledge for people about these products. Unfortunately, there's been a lot of misinformation out there. So I think that we're on the right track to be able to deliver information in this manner.
Right.
So I got involved, actually, it's a funny story because I was a medicator as in high school and college, and then completely walked away from the plant due to it giving me anxiety and paranoia for many years. And then back in 2013, my family got very involved with advocacy and working to get the amendment on the ballot and help to move the program forward in the state of Florida. Both my brother, who was in the front lines educating and getting petitions signed, and then my stepmom, who runs Epilepsy Florida, got behind it. And then I kind of was like, well, this is interesting. You know, here we are, have something that's quote unquote a drug, but that's being pushed for medical use. So what is this really? What is this plant? What is this thing they're calling plant medicine?
Right.
And from there, I just started investigating more about it. I've always been a holistic person. I've always leaned more towards wanting to find things that can help that are not Western. I'm always an Eastern medicine person first, and this was a supernatural fit for me.
Sure.
As I discovered more about it, it almost became like this, what I saw when I first really studied it was the Jenga. It was like the final piece of the Jenga. It like put that block together for me. I was like, oh, this is the last piece that I need in my understanding of holistic medicine.
Sure.
To be able to really get healing, combined with other things. It's not the end all be all, but it's such a powerful tool. And it just kind of came together for me. And then as I understood the medicine more and really the vastness of what it can do, both on the THC side and on the non-THC side, I haven't been able to stop. It's just been this constant desire to learn and increase my well of knowledge when
Sure.
it comes to this product.
Yeah. As a physical therapist, I know we're always trying to teach our patients different ways to get better that don't involve medications necessarily, right? More holistic, natural stuff,
Right.
movement-based therapies. So CBD's, I feel like it kind of fits into that realm a bit. And I think a lot of our patients and clients can benefit from it. So just to get right into it, what is CBD exactly? Like, what's the difference between CBD and, say, THC? And do they work together or do they work independently? Tell us a little bit about that.
Sure. So CBD stands for cannabidiol.
Okay.
It is one of the cannabinoids that comes out of the plant. To be really frank, CBD and THC, they're not that different except as a plant, except in that if the CBD plant itself grows past a certain point, it gets what's called hot. And when it's hot, it becomes THC. So it's just a more immature part of the plant.
Gotcha.
Is what it is, basically. That's from a very basic standpoint. The interesting thing about this plant is that what everybody knows is THC and CBD, but those are only two of the things that are in this plant. You've got CBD, which is cannabidiol. You've got CBG, which is cannabigerol. You've got THC. You've got CBDA, which is the acidic form. You've got all CBN. You have CBC. So all of these cannabinoids are all in the plant and provide different types of relief for people, depending on what somebody's needing. The interesting thing also about this plant is that everybody's body is different. So you might take something that works for you and the next person might take it and it might not work in the same way.
Sure.
similar to an Advil or a Tylenol or a Motrin. And some people, or even blood pressure medication or heart medication, you might have 5 people with the same body, the same height, the same weight, even the same diagnosis, and they might say, well, you can take this one and the next person can't because of the way your system absorbs the medicine. And this is exactly the same, but it doesn't have the pharmacological side to it. It has what I call the pharma side, which is the FARM as opposed to the PHRM side.
Got it. Yeah, sure. I mean, everyone's body takes different therapies and medications differently. So I would assume it would be the same thing with these products too, right?
Correct.
So speaking of the effects and the benefits, it seems sometimes like a miracle drug. Like it helps so many different things, whether it's seizures, stress, anxiety, depression, chronic pain, migraines, acute pain. So like, is all this legitimate? Is this very helpful with all these different pathologies and issues? Tell us a little bit about your experience and whether or not it can benefit all those different types of ailments.
Sure. So it can be. It also depends on, again, it's very specific because we have something called the endocannabinoid system, which is in the body. And this is the system that exists in all of us, but also has not been activated in over 100 years because they took hemp and CBD and THC out of our water, out of our earth, out of our food supply. So our ECS or endocannabinoid system didn't receive the medicine. So there's these receptors, and those receptors have been shut down. So when you feed it this medicine, those receptors start to open. And as they open, it creates homeostasis in your body because they start to bind to your receptors, and then everything starts to balance. So if you're functioning on a spectrum that goes like this, if you're functioning on this end of the spectrum, you want to get as close to 100% as possible, and it helps to shift you towards that. But it has to do a lot with consistency, and it has to do a lot with finding the right formula for you as an individual. The consistency you understand because as a physical therapist, or even if you're trying to lose weight or you're trying to build muscle, you have to be consistent with something. You can't eat well for 3 days and be like, oh, I'm gonna lose 20 pounds. And you can't lift weights for, a week and think you're gonna build muscle. And if you're doing physical therapy and massage, that's why it's called therapy, because it has to be an extended period. And this is the same because it's plant medicine, it's holistic. It is not a pharmaceutical. And we do something very unique, really unique. There's very few people doing this right now. We do genealogy testing. So what we're finding is that if you come, even if you come with your own genealogy test like a 23andMe or Ancestry.com, we can upload it into our database, and that will, based on your results, will spit out a cannabinoid profile. And what we're finding is that you might fall into insomnia, or you might fall into pain, or you might fall into anxiety, whatever that genealogy category is. And then we have certain formulations that we can provide for you based on that genealogy. So it's taking a lot of the guesswork out of this medicine, which is really refreshing because people unfortunately are spending a lot of money on products that either don't work, and that's a different part of the conversation we'll get into about why that might be happening. But also it might be too strong or not strong enough. And also some people think that they need THC and they really need CBD, and some people think they need CBD and they need a little bit of THC. So it really takes out a lot of that guesswork for people.
Got it. So back to the THC versus CBD topic. Give us the difference exactly. So THC does what exactly to our bodies versus what CBD does to our bodies?
So THC creates the more psychotropic effect. So when they say, oh, it gets you high, it's that highness that you get in your mind and in your brain and from being elevated psychotropically. CBD does not get you high. It still has 0.3%, which is the legal limit according to the Farm Bill that got passed in 2018. If you took an entire bottle of CBD, or if you ate a whole jar of gummies, you would probably get high. But that's not the point of CBD. CBD acts more for the neurological side. That's why it works for epilepsy. That's why it works for tremors. That's why it works for these neurological types of things, also neuropathy and things like that. And the THC is more for the body and the mind. When you combine them, sometimes if you just take a little bit, people that are really sensitive, like I'm super, super sensitive to THC. So I do a higher CBD regimen, and then I do a little THC to kind of activate that CBD,
Right.
so that I get the balance. But it took me a long time to get there. I had to really experiment
Sure.
a lot with it.
So you touched on the fact that consistency is kind of the key with this stuff, right?
Yeah.
And we do preach consistency with therapy as well. A lot of people come in and they expect to be fixed right then and there that session, which is not very realistic, right? So we try to preach the fact that it's a regimen. It's all about, day in and day out, sticking to habits and then seeing results long term. How do you explain that from a CBD standpoint? How often should you take this stuff? Does it matter if you're in pain or if you're not in pain? Should you take less if you're not in pain versus if you are in pain, you should take more? Is there a difference between how often you should take it, whether you're in pain or you're not in pain?
I mean, yeah, you can't compare somebody that has, for example, back pain that is debilitating, where they have trouble walking, to somebody that's a more functional, mobile person.
Sure.
What I have found in my own process of healing is that you want to take enough to break the cycle of pain, so that then you can take your pain levels down, and then you can start to get out of that mental state of being in the pain, and then you can start to enjoy. And then once you bring the joy back, then the pain, then it's not as bad. It's being in that constant pain. And I've been in pain where I haven't been able to function at all, and it's debilitating, and now, thank God, I take a regimen, and I just do every day. I do THC on a consistent basis, and I offset. I'll do tinctures, which are sublingual oil, and then I'll add in gummies in between. At night, I might do a THC regimen. It just sort of depends on how I'm feeling, and sometimes I'll have a flare-up.
Right.
Those flare-ups also determine. But everybody's very different, and if you're somebody who has, that's a veteran that has PTSD and has phantom pain, you're going to need a very different approach to what is going to serve you and get you to a better place than somebody that's a more functional person.
Sure.
So it's hard to say one specific thing because everybody's an individual,
Right.
but the goal is to get out of chronic pain. And there have been documented cases. Unfortunately, there hasn't been studies, quote unquote, because of the fact that it's been removed for so long. But there have been people that have been documenting. Even in cannabis, this book that I have here called Cannabis for Chronic Pain was written by a friend of mine's father, and he's out in Colorado in Boulder, and he's probably 70 something, and he has over 6,000 patients documented that he has healed with cannabis, and it's fascinating. It's fascinating. And actually down here in South Florida, I work with the premier doctors down here. Specifically, one is a pain doctor and one is a functional medicine doctor, and it's specifically to address those things. The pain doctor has gotten a lot of her patients off of their pain meds through cannabis and CBD treatment. So it works. You have to be willing to take the time to put into making it work. You have to be really committed to getting off of your pain meds.
Sure. Touching on different doctors and physicians, you work with several, I'm assuming. Do you see a trend towards doctors being more open to using these products or recommending these products to their patients? Or do you see a lot of pushback on whether or not they want people to use this stuff and try to stay more towards the traditional medications that they've been giving people for years?
Yeah. It's changing very quickly. As evidenced by our last election, we just got 5 more states that came on board with marijuana. Some were recreational and some were medical. I think we're up to 45 states out of 50 that now have some form of marijuana program, which tells you what's happening from the people side and what we're wanting as individuals. The doctor side, I think the challenge is that it's still not federally regulated. It's still a Schedule 1, although there's right now, this week, the MORE Act is up for vote, which will decriminalize and expunge cases and a few other things. And I think as it starts to, as those things start to happen more, the doctors will come on board more. But some of them are still scared, and they're very doctor oriented. They're not taught these types of things.
Right.
So you have to be somebody who's willing to break out of the mold and that box that you're put into as a student and as a physician. But we're seeing a lot more, especially when you start to see things change. When you go to your doctor and you're healing cancer from taking high doses of THC, and they're like, "How did you do this?" So, whether it's a skin cancer or something else, or bone cancer or whatever it is, or when you're when you personally are able to take a dose of CBD and it clears your anxiety, and you start telling your doctor, they start to listen, especially when it becomes mainstream as it's become.
Sure.
So it's definitely a challenge. It's part of the fun of the industry is being sort of a visionary and really just carving the way for people to get on board. So
Yeah.
it's been a nice journey getting the right people and creating the relationship with the physicians that are doing it.
Sure.
Of which there aren't a lot, but there's enough that that are good, that you can trust the process.
Right. You kind of get your network of people that you trust, and you can kind of push forward together, right?
Correct. Correct.
You have a ton of products here,
Yeah.
different methods of taking CBD. Let's talk about some of the different methods. I mean, are there more effective methods than others, whether it's topical, oral, or even just smoking it? Do you have any recommendations or anything you can educate the audience on how they should take these products?
So, yeah, that's a great question. Effectiveness, I think, has a lot to do with method of entry. So it's all effective as long as it's a product that is quality, that you trust, that that's been tested. You have to get it from a source that's trusted. That's the most important thing. Don't buy it at a gas station. Don't buy it from the corner store. Go to a clinic such as ours, go to your doctor, go to somebody that has experience and that knows this industry, knows the farms, knows the people formulating. Otherwise, unfortunately, you could very easily have a bad experience with a product, and then you'll be like, oh, CBD doesn't work, when it actually does work. So as far as more effective methods, it's more about faster. So if you're somebody that suffers from anxiety, and you need something fast, you want to take a sublingual such as this. A sublingual is just under the tongue. So you would just take an oil such as this one, okay? And you would pop it under your tongue, and you would leave it on there 20 seconds so that it goes through the blood-brain barrier,
Right.
and it goes into your system. And the nice thing also is you want to find products that have the dropper that's measured, like this one. This has a measured dropper, so you can take 1/4 of a milliliter up to 1 full milliliter dose. Dosaging is also a big thing about how.
Yeah, that was my next question, actually. How do you know how much to take?
Right.
Or does potency matter? You see some products have 500 milligrams, some have 1,500. Does it vary based on the product on how much you should take, or the type of product it is? For instance, like with the drops here, what would you recommend?
So a couple of things. This product happens to be a 1,500 milligram product, okay? So let me give you an example. Well, the box here is 1,000, two different bottles. But when you see the milligram on the bottle, this one is 1,000 and this one is 750. Okay. These are both inside a 30 milliliter bottle, okay? People think, oh, every time I take a dose, I'm taking 1,000 milligrams, but that's not what you're taking. That's what's in the entire bottle.
Gotcha.
So if you were to take one full dropper, 1 milliliter of product, okay, which is one full dropper like you see here. I don't know if you can see the 1 milliliter. Okay, that you divide the 1,500, which is what's on the bottle, by 30, which is the quantity of liquid.
Right.
This would be a 50 milligram dose, 50. If you were to take half a dropper, it would be a 25 milligram dose. What we have seen as a community is that, unfortunately, as adults, we're pretty sick in general. We have pain, we have anxiety, we have depression. We have all sorts of things going on,
Right.
stress, and a 50 milligram dose seems to be, when it comes to a tincture, seems to be what works for most people.
Okay.
It also has a lot to do with your age and how sensitive you are. Some people are super sensitive, they can't take that much. It'll put them to sleep, or they won't like how they feel on it. So it also depends on how large you are, like body-wise, you know, if you're female, if you're male. My opinion, start low and go slow.
Work your way up as you build your tolerance up or determine what works for you.
Titrate
personally,
it.
right?
Titrate it. You can always add. You cannot take away.
Yeah.
You cannot take away.
Yeah.
Right? Once it's in, it's in. So, you know, I tell somebody like you, I would say, take a full dose.
Sure.
You know, somebody that's smaller or younger, if you're a child, I would say take 5 drops. You know, so it really depends on you as an individual. That's on oil. We also have gummies. Gummies come in different forms in terms of strength as well. These are 1,000 milligrams as well, but you've got 40 in here. So you take 1,000 by 40 and it's a 25 milligram gummy. This seems to be a good dose. For example, if you were to take 2, somebody were to take 2, somebody came in here, she's got a lot of anxiety, she took 2 and she was like sleepy.
Oh, wow.
Yeah. Somebody like me, I take 2 and I'm fine. But I also have I've also been doing this for 5 years, so my system knows it's functioning in a different place.
Sure.
But based on that, somebody can take a 500 milligram, buy a bottle that's a 500 milligram, which would be half the dose of 12.5 milligrams of CBD. So it varies. This is more of a water. So this is a nano water. This product is pretty amazing. It's a fast acting. So a nano sized product is something that's encapsulated in like a bubble.
So that means it gets into your system faster
Correct.
than the other ones. Okay.
Correct. So what happens is you uptake it faster. So when you drink it, you swish it like it would be like a Listerine, again, so that it goes through the blood-brain barrier.
Right.
And then you swallow it, and then your system receives it faster,
Okay.
uptakes it, and also the bioavailability increases, so you use more of it. So you feel it faster and you use more of it. We've seen that this has stopped tremors in people, which is very powerful. People that can't, especially Parkinsonian or tremor diagnoses, and they can't even lift a cup to drink or feed themselves, and this has helped significantly. And it has no THC, it's a CBD based product. So again, what's effective, it has a lot to do with what's going on in your body.
Sure. And what type of body you have also, right?
Yeah.
So going back to the nano component here, so someone who has Parkinson's, we see Parkinson's a lot in the physical therapy realm. If you're dealing with conditions that are chronic like that have been happening for years, that people are dealing with this all day long, are nano methods more effective for those types of people? Those are the people that you would recommend this to more so?
Correct.
Okay.
Yeah. People like that I would recommend more. It might be from one dose that they'll see a difference, or it might be that they have to build, because remember, these Parkinsonian types of tremor types of things, it's a neurological thing.
Sure.
CBD works on the neurological system.
Okay.
So potentially it could work right away. It might not go from 100% a tremor to a 50, but it might go from 100 to an 80, which is a big difference for somebody who can't do anything because they can't control the tremors. We've also seen THC stop things instantly, like for Parkinsonian and tremors as well. So sometimes, again, you need a little bit of THC to sort of activate things.
Right.
It's a little bit of trial and error.
Okay.
You also have smokable. Some people smoke. They love smoking. They love the smell of flower. They love the taste of flower. And they can smoke, and that's their preferred method. This is actually a Hawaiian haze. It's a 14. It's a 14 grams in here, but there's a super high. It's about a 22% CBD content, and it looks and smells just like a THC, but it's actually a CBD.
Yeah, it does smell pretty much the same.
Yeah, and it's actually really good. Some people like to mix this with their THC, so they'll do a CBD THC mix into their pre-rolls or whatever they're smoking in their bowls or however you're smoking it. Some people like it. Other people want nothing to do with smoking. So it just depends on also your preferred. Some people have lung stuff. Obviously, you're not going to give
you
up
probably don't want to
something.
smoke then in that case, right?
Correct.
So let's talk about the athletic population.
Okay.
You know, I work in particular with a lot of higher level athletes or people who work out consistently and want to do maintenance for their bodies, not necessarily have injuries, but want to just stay or recover their bodies better. Where does this fit into that regimen? Do you have products for athletes in particular?
We do. We do. So the product, this product's really cool. This is a pre-dosed product. So it's actually patented, and what they've done is already put the protein and the CBD into the product so that that you add your liquid, your water, or whatever you're adding to this, you put it in, you shake it up and you drink it, and you're getting your 25 milligrams of infused whey protein CBD. This is a post-workout type of product. This is really good for athletes because if you're doing a triathlon or you're doing a marathon, you don't want to have to be like, oh, I need a powder, you want to be able to have
quick access.
Quick access.
Yep.
And they work really, really, really well. When we have this, we have a vegan and we also have a pre-workout product as well that's designed for that purpose. These are doing really well with our athletes. It's a specific kind of person when you're an athlete at that level, especially if you're a higher performance athlete. Also, the amount of inflammation that you get from pressing on your body like that can be intense. So we've acquired some products that are combined with superfoods and herbs to help with some of these things. So this particular one is black pepper and turmeric. Which is our anti-inflammatory properties that work really well for people and taste really good too. Really good for athletes as well, or any kind of systemic inflammation that somebody might have.
And I think a lot of people have systemic inflammation or issues systemically and don't even realize they do, right? And then when they take this, they probably see a difference down the line, right? Just from having it consistently and keeping those levels a little bit lower, right? Even if they don't tax their bodies out like an athlete would.
Even if they don't tax their body like an athlete. Yeah. Inflammation is the biggest culprit for disease in this country. You don't even know you have it, and you don't understand why you feel a certain way, and it has to do with inflammation. We also these products here are really good, these topicals. I find that layering is really good. Okay. So typically, you might grab a massage oil or a pain cream and just use that. What I find is that the more you layer, the better. You end up being able to really address different parts of the body. So something like this oil can open up the body, and then you can layer it with a pain cream. This is more of a pain cream. This particular product was developed as well for athletes and a PT department at a university by doTERRA. This is an excellent. So when people come in here, we'll do this and this on them and say, see how you feel, or this with this, and they walk out much better than they walk in.
I'm sure.
Yeah. So it's also about giving the attention, to the body that it needs. So, and as a PT and somebody that deals with that a lot, you may want to start experimenting with it, but the CBD, again, it's going to work and it's going to get into the system and it's going to start to open up the body. And since your skin is your biggest organ, it's going to absorb into your skin.
Gotcha.
Yeah.
Okay. Yeah. There's so many different products out there, so many different companies selling these products. How do you know what's legitimate, what's not legitimate? I mean, what should people look for when they make a purchase? Is there documentation that they should get, or just like, should they look at the bottle and just look at different ingredients and make their decision that way? What do you recommend there?
So that's actually a great question. And that's, I think, one of the most important things that people don't know about. Yeah. You always want to make sure that your product is has certain things on it. You want to make sure it has a QR code. You want to make sure it has a UPC code like here. And you want to also make sure that it has the ingredients in it, right, of the product. When you scan that QR code, you see all these products, they have the QR code on there.
Right.
When you scan it, what's going to happen is that it will pop up. It's supposed to pop up a website or take you somewhere that will lead you to a certificate of analysis or a COA. A COA is provided by a third party laboratory.
Okay.
Okay. On the COA, it will have a UPC code. It will have the name of the company that the product comes from, the name of the lab that's doing the testing, and then it will give you the results of what's in the product. For example, this one, you have all the different cannabinoids, which we were talking about earlier. We were talking about THC, we were talking about CBD, which you see here. THCA is the acidic form of THC. CBDA is the acidic form of CBD. What happens is when you decarboxylate or heat CBD or THC, the acidic form is what turns into the non-acidic form. This also has CBG, which I think is important to talk about, which we can talk about in a moment. And then here you'll see the results of what's in it. Non-detect is the ND or the percentage of the product that's in it. Okay. So that's your cannabinoid profile, and you can see there's a graph here.
And all this pops up when you scan the QR code.
Supposed to.
Okay.
If it doesn't, don't buy the product. It also should talk about the terpenes that are in the product. Terpenes are basically the same as an essential oil. The aroma you get when you smell a product, and it could be more piney or it might be more citrusy, right. Those are the terpenes.
Okay.
Okay. So if you know about essential oils, you'll know that it's a very similar type of thing. So these are the terpene profiles of what's in this particular product. You've got alpha pinene, myrcene, beta ocimene, limonene, linalool, and they all have a different purpose, okay? Which is a whole other discussion. And then, of course, you want to look at pesticides. Pesticides and heavy metals, to me, are the most important. Why? Because you're trying to take medicine. You don't want to get a product that hasn't been tested for a pesticide or a heavy metal, because why are you taking something that has a pesticide or heavy metal when you're trying to make it medicine?
Yeah.
You don't want that in your system.
Makes sense.
Yeah. So this has the list of the pesticides, and then you'll see that here it all says ND, which is non-detect.
Okay.
Okay. And then on this other side, you have the heavy metal analysis. Okay.
Awesome.
So this is it's called the full panel COA.
Okay.
It's called the full panel COA. A lot of companies don't do it. Now the guidelines are getting stricter. There's a lot more requirements happening. It's getting a little more regulated, so you'll start to see that more. But there's a lot of companies still out there that don't provide that, and if they don't, just run for the hills.
Right.
You know.
That's very helpful. I mean, I didn't know anything about this, the access to this, and whether or not it should be on the product. So I think that's going to be very helpful for the audience in determining what they should buy, right, and if it's legitimate or not.
Yeah. Good.
So you covered a lot here. We looked at some of your products. Everything's, I'm very thankful that you joined us today on Chainwork TV, and that you have educated us. You educated me, and I'm in the medical field, so I think, whether they're patients, clients, regular people, or healthcare practitioners, they can learn a lot from what you're talking about here. So thank you for joining us.
I appreciate you having me on, and I appreciate working with you, and
Yeah.
we all learn from each other. So
Absolutely. So thank you for joining Chainwork TV. We have Yasmine Egozi once again here at Canacentric on Miami Beach, and we're talking all things CBD. Hope you guys learned something. We'll have some links in the description below so that you can get additional information on the products that she's talking about. And thank you once again.
thank you so much. I really appreciate being here, and definitely find us on the internet. Canacentric or CBD and More is our store, and look forward to having more discussions with you.
Perfect.
Appreciate it.